And thank you for tuning in to Straight Talk for Texas Trustees. My name is Susanna Ramshaw, and I oversee trustee programs and engagement for THT. This new program is a series of pre-recorded conversations between healthcare governance expert Pam Knecht, President and CEO of Accord Limited, and THT's network of hospital trustees and executive leadership. As our facilitator, Pam will guide our participants through various issue areas affecting hospitals and boards across the state to share insights and lessons learned regarding effective governance and leadership. Today's conversation is building new partnerships for community health improvement. We are joined today by Jason Wren, President and CEO of Wise Health System in Decatur, Texas. Alongside Jason is his colleague Jordan Holtzbog, Manager of Population Health, and Carrie Williams, Wise Health System's Board Chair. Welcome to you all, and thank you for joining us.
Thank you.
Before we dive into the conversation, I just wanted to share some fast facts about Wise Health System so our listeners can get to know you all a little bit better. Decatur is a partly rural, partly suburban area with a pretty large service area. They have a hybrid hospital type. They are a government hospital authority as well as a 501c3 not-for-profit with a bed size of 186 beds across various facilities. And you can see their myriad offerings of inpatient, outpatient centers and services. And their board is 11 members strong. So without further ado, I will hand it over to Pam to begin a Straight Talk for Texas Trustees. The floor is yours.
Thank you, Susanna. I'm very excited about finally getting a chance to do this particular program. We've enjoyed preparing the program with Jordan and Carrie and Jason, and are really excited about this conversation that I'm sure you'll all feel is very valuable. So let's go ahead and dive into the first question, and that would be, what is the importance of a community health improvement plan? Jason, you want to go ahead and help us out with that?
Yes, I'd be happy to. And thank you, Pam and Susanna, for including Wise Health System in this project. We're hoping to share some important information with boards and trustee members throughout the state. You know, there's a couple of components to this question of the importance of it. Susanna mentioned in the background facts a moment ago about Wise Health System that we have dual status. We're both a governmental entity as a hospital authority as well as a 501c3 nonprofit. And part of the answer to your question is, you know, this is something we're required to do as a 501c3. I think the first community health needs assessment we did was back in 2014, and we did another one in 2017, and we're actually just underway with our third one in 2020 this year. We have to do them every 3 years. And we do that in part as a 501c3 to, you know, meet the requirements of the Affordable Care Act and some other things that are out there. But I think the more important answer to that question is, and this really gets more to the meat of the question about community health improvement plan and not just that needs assessment that we're required to do. You know, as a hospital, we take very seriously our mission to take care of people when they come see us, when they're sick and they have health issues going on. But we also spend quite a bit of time talking about our role to help our community and take care of our community outside of the walls of our facility, to do our part as the health entity in the county to improve the overall health of the population and try to prevent people from ever having to come see us in the first place. And I know that's a little counterintuitive from a business standpoint, but we do take very seriously that role of trying to identify what's going on in the community that might lead to overall and better health of the population. And this is a very important way that we're able to identify those needs and figure out our role in making those improvements, is not only doing the required community health needs assessment, but also being very intentional about developing plans and activities coming out of that assessment and what those identified needs are so that we can really be proactive in trying to address these needs. That dual status we have as a governmental and a nonprofit, you know, there had been some conversation we had kicked around a couple years ago as to whether we really needed to continue being a 501c3. Some of the benefits we get from that, we already get as a governmental, and there are some requirements such as doing a CHNA that come along with being a 501c3. But we really concluded that even if we weren't required to do that assessment, we would want to. And it's for those reasons that I just mentioned to make sure we are being very proactive as the hospital system in our area of identifying needs outside our walls and playing our role and being a good corporate citizen to address those needs.
Right. In other words, doing this is absolutely part of your mission as an organization.
Absolutely.
Yeah, which I think is a wonderful thing for us all to be focusing on, especially board members, to make sure that we're helping to ensure the mission is accomplished. So let's hear a little bit about how you went about, excuse me, hopefully we can edit that part out. Let me start back out with the mission comment. I'm gonna get a drink of water. Sorry, Susanna. In other words, doing this is really important to the mission of the organization. Is that what I'm hearing?
Yes, absolutely.
Yeah, great. Really important for all trustees to make sure they're understanding and paying attention to. So Jordan, maybe you could tell us a little bit about how you actually went about doing this community health needs assessment and creating your community health improvement plan.
Absolutely. So in 2017 is actually when I started with the company, and I think it was like my first week, I first heard of a CHNA and that I would be authoring a CHNA. I'd never heard of one before, but there are a lot of really great resources that Google allows you to find. So I came across the American Hospital Association's toolkit for community health improvement, and there's the step-by-step toolkit that I actually used. So the main things that we wanted to focus on was feedback from the community, and part of that, you need data, but you also need narrative. So when we were going through the process, new to the community, we really wanted to focus on key stakeholders and people that had influence, but also knowledge of different things that are happening in the community, different agencies. So we definitely relied on the board to make those connections, especially with their engagement in the community anyways. Susanna said we have 11 board members who are very well involved in the community. They have their own roles as business owners and participate in many different other types of organizations in our community. So they helped make those connections and identify key people.
In other words, doing this is really important to the mission of the organization. Is that what I'm hearing?
Yes, absolutely.
Yeah, great. Really important for all trustees to make sure they're understanding and paying attention to. So Jordan, maybe you could tell us a little bit about how you actually went about doing this community health needs assessment and creating your community health improvement plan.
Absolutely. So in 2017 is actually when I started with the company, and I think it was like my first week, I first heard of a CHNA and that I would be authoring a CHNA. I'd never heard of one before, but there are a lot of really great resources that Google allows you to find. So I came across the American Hospital Association's toolkit for community health improvement, and there's the step-by-step toolkit that I actually used. So the main things that we wanted to focus on was feedback from the community, and part of that, you need data, but you also need narrative. So when we were going through the process, new to the community, we really wanted to focus on key stakeholders and people that had influence, but also knowledge of different things that are happening in the community, different agencies. So we definitely relied on the board to make those connections, especially with their engagement in the community anyways. Susanna said we have 11 board members who are very well involved in the community. They have their own roles as business owners and participate in many different other types of organizations in our community. So they helped make those connections and identify key people to talk to. We also used the Robert Wood Johnson Foundation for countyhealthrankings.org to get our data from, and we also deployed a community-wide survey and received over 300 responses in that survey. So based on that information, I'm not sure if the next slide has the, yes. So based on that information, we put together a 100-page report, which was great. It had a lot of great data and came up with our top 10 needs. So these are just some of the needs that we've condensed in a marketing form. But we came up with 3 committees. We have our Mental Health and Substance Abuse Committee, our Healthcare Resource Awareness Committee, and our Healthy Behaviors Committee. So those committees are comprised of community members from all different types of sectors and really focus on getting new perspectives as individuals as well as business owners as too. So
Mhm. Jason, do you want to add anything more about how those committees were created or how they're actually functioning?
Yeah, one of the great things about doing the CHNA as part of this process is to, again, as Jordan said, identify what the community perceives as some of the top needs in your area. And going back to what I said before about being proactive and trying to take the lead to address those issues. We felt like we didn't just want to have the information, we wanted to do something about it, and made the decision to form committees with that purpose, to try to look specifically at those areas and figure out ways to address them. And some of the top needs that came out of that, you can see reflected in the committees that were formed. We formed 3 committees, one for mental health and substance abuse, one for healthy behaviors, and one for healthcare resource awareness.
Great, yes. And it's interesting to see the cross connections then between the committees you formed and the challenges that were identified. So for instance, obesity was the way the need was identified, right? But you turned that around and talked about the Healthy Behaviors Committee. I'm assuming that that's
Yes.
part of what's happening with that committee, right?
Yes.
Yeah. So I think that's a small but important lesson, is that we figure out how to reframe once we've identified what the needs are, to then think about, well, what is it that's going to be the way to solve that issue, and call that out as something that's more positive and something you want to work towards as a goal. Well, Kiri, I'm interested in hearing what role the board is playing in all of this, and want to ask you very specifically, what has been the board's role in community health improvement?
Well, the first step we made was having a Jordan. I think that's very important. No, obviously, the board has to approve the CHNA and the overall strategic plan, and with that includes initiatives to address the issues identified in the CHNA. And we're very blessed on our board, like Jordan touched on this, to have out of the 11, all of them, including myself, that are involved in this community in several different ways, and we're very approachable. Folks know we're on the hospital board, and we don't mind. There's not anybody on that board that doesn't mind hearing what folks have to say in our community. So.
Great. Well, we'll talk a little bit more about the role of the board in a couple of minutes, but I want to go ahead and have maybe Jordan address what are the specific strategic partnerships that were able to be formed, whether they came from board members originally or from some other resource that you ended up working together with to try to address these community health needs.
Sure. So in the American Hospital Association CHNA toolkit, they also give you kind of a map of who should really be involved. So there are many different sectors, pretty much every sector you can think of, to make sure that you have well-rounded feedback included in the report and any committees that go forward. So very quickly, we were able to connect with the county and the Wise County Sheriff's Office, and that's been one of our biggest partnerships. We've also gotten really close with the Decatur Public Library and local ISDs, so obviously touching on education. And then we as a health system also have a community-based gym. It's called Fit and Wise, and they already had some healthy behaviors initiatives, so obviously we partnered with them. And our faith-based community, we do have a lot of churches and a lot of faith-based organizations here, so we wanted to make sure that those relationships were garnered and utilized in the best way possible.
Jordan, when we were talking before this call, you mentioned a little bit about what came out of that partnership with the Sheriff's Office. I wonder if you could speak a little bit more about that.
Sure. So it kind of was perfect timing. We finished our CHNA and developed our strategic plan. Obviously, mental health and substance abuse was one of our committees that we made. And very quickly, our county judge and the director of our behavioral unit identified a grant opportunity, Senate Bill 292, that we decided to apply for. Yeah, this is a good visual for it. So it was a partnership between Wise Health System, the Wise County Sheriff's Office and Helen Farabee, who's the mental health authority for the county. And what the grant provided was funding for us to dedicate 2 inpatient beds in our behavioral unit and our inpatient behavioral unit to the county. So in talking with Sheriff Aiken and talking to Judge Clark, we just see this, tumble effect of a revolving door, if you want to say, from substance abuse and trying to get help or waiting for a bed, with the reduction of inpatient mental health hospitals in the state of Texas. So they're able to get help here. They're not detoxing in an appropriate way. They're able to get substance abuse treatment all in their community. So that's been a huge, huge partnership, and we're really excited to continue that with the Sheriff's Office in the county.
Mm-hmm. Yeah, well, as you probably know, mental health and substance abuse issues are problematic all over the country. And so I think it's really exciting that you've created some partnerships that are helping to address the need right at the beginning. Jason, anything you want to add about this whole topic of strategic partnerships and or what you think the next steps are?
Yeah, one of my goals is to get our board even more engaged in some of these activities. And as Carrie mentioned, we've got 11 fantastic board members, and they are not only care about what happens with Wise Health System, but care deeply about the people of this community, and I think are very, very supportive of our role in this. I'm always probably overly sensitive to their time, though, because of how busy they are. They've got full-time jobs. Unfortunately, we're not allowed to pay them anything, so they are volunteering their time to be part of our board. But I do want to, as part of our next steps, some of those committees that we talked about earlier, I would really like to not only have the community members and some of our hospital staff members that we currently have on those committees, but try to identify a couple of board members as well to engage in those committees as often as they can, just to add further voice and insight into these activities and what's going on. We're also, as I mentioned earlier, we're starting our 2020 Community Health Needs Assessment. In fact, I was part of a focus group earlier today that Jordan put together to start gathering the information that's going to go into that assessment and what our future community health initiatives and plans are. And we certainly want to engage all of our board members and trustees in that process, both in focus groups, individual interviews, just to make sure that that broad perspective that they bring from all the different areas they touch throughout the community are brought into this process, and we have their insight as we develop these plans.
Sure. I know some boards across the country are engaging individual board members like you described. Some are engaging the full board. Some have even created a board committee around community health improvement, if that seemed appropriate. It'll be interesting to see as you move forward whether these committees you originally created, as you said, with staff and community members, adding board members in, I would imagine you're gonna have to figure out then what's the process for making sure that an individual board member sitting on a committee is reporting back up to the full board in a way that the full board understands what's going on. Any comments around how to make sure that happens?
Pam, I'll add, I think it relates to that. Jordan and I have had conversation recently about her doing a presentation to the board, and I think we've got that scheduled for our September board meeting. That's not so much focused on the CHNA. When those results are in and that plan's developed, we'll need to bring that back to the board for their approval. But in September, we're going to focus more on just a lot of these activities we're talking about today. The committees and what they're doing, and our community health initiatives and our partnerships and strategic partnerships with the Sheriff's Office and the county and those local faith-based organizations and all the things that Jordan mentioned. And so I guess I would encourage board members to just ask your hospital staff, what's going on in these areas? What are they doing in these areas? I know for me, it's sometimes challenging. There's so many things we want to bring to the board and show the board, but you just don't have time in a monthly board meeting to do it all. And I probably have not done as good of a job as I needed to fully educate the board on all of the different things that are coming out of these assessments and plans that they're approving at a high level, to really show them the fruits of that and the results of that. So I'm going to certainly do a better job of that. And that's part of the reason Jordan's going to be presenting to them in September, is to talk more specifically about some of this. But I really would encourage board members to talk to your hospital staff about these things and just ask those questions. And if there are more things you want to hear, then ask them to bring that to you. And I'm certain they'll be more than happy to do that.
Mm-hmm. Carrie, I know we were going to talk about something else next, but it seems to me this would be a good point for you to jump in and comment on what Jason's saying. Do you feel that the full board is hearing what they need to regarding the community health initiatives?
I think so. You know, I think my advice would be communicate, 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 and we're in a good place there. Management brings us the relevant information we need in a timely fashion, and that just helps things move along. And Jordan already has me signed up on a committee. I think it's coming up here towards the end of the month. So
which one is that going to be?
You'll have to help me, Jordan. I don't have my email up.
I've got him on one of our focus groups for this month, and then next month we'll get you on an actual committee.
Okay.
Great. We might need a follow-up conversation to see how that goes.
I'd like to comment on that too. I think that that's really important, and what Jason's saying about from a strategic perspective, the things that we're doing, they've probably heard about, or they've probably have somebody in the community that's mentioned it to them. But from an umbrella perspective, this is coming out of CHNA, out of that plan that we developed. So kind of looping back things to see the whole picture is really important.
Yeah, I hear that a lot, not just from your organization, but others, that creating those linkages between each of the initiatives, not just community health improvement, but in general initiatives that are being taken by management, back to the strategic plan. So it's really clear. This is what we said our strategic direction was going to be. Here are these strategic goals, or whatever terminology you use, we set that are board approved. So here's how this initiative fits right back into this strategic goal. So the board members can really see how the various detailed things that you're doing link back up to the big picture.
And that's something that has recently changed too. I don't know if you want to mention that change, Jason, but I think that's been super insightful in getting board feedback and community feedback and employee feedback specific to that strategic plan.
Yeah, we've just real quickly, Pam, we've modified our strategic planning process quite a bit over the last 2 to 3 years to really create more board engagement and involvement. And obviously community health initiatives are part of that, one component of many. But as Jordan said, I hope that this more refined process we have now, and really being more intentional about it, does help connect those dots and bring back that loop that Jordan was talking about, to really show the actions and the results that come out of those higher level strategic discussions.
Mm-hmm. Okay. Jordan, was there anything else that you wanted to make sure, or wanted to make sure you advised other organizations to do regarding keeping their board members informed and making sure that they're hearing what they need to hear?
I think that one of the biggest barriers would probably be this idea of what a board is. I think that whenever I started, I was probably terrified of the board. I didn't know what it meant. I didn't know, what their role was. It was just this people that sat around a table and made decisions about what was going to happen. But over time, and especially in the type of community that we have, learning who each of them are and having conversations with them outside of work too, because you run into Carrie at the grocery store, or if you need to go buy a car, you can run into them. So learning about them and about their role and their purpose and being on the board is really important. So like Jason said and Carrie said, go talk to the staff and really provide that engagement both ways. A lot of times we talk about, we've got to talk to the board, but our board is really good about coming in and having those conversations at a more frontline level.
Mm-hmm. Yeah, well, making sure everybody understands the role of a board is another evergreen issue. I think even some board members who first come on a hospital health system board are not entirely sure what their role should be in this setting, because most hospitals and health systems are much more sophisticated than, say, your standard social service agency. So if you only have experience serving on a very small not-for-profit board, you probably don't totally understand all the responsibilities you have as a board member. Carrie, how do you feel that your board has been doing in orienting and having continuing education programs for your board?
I think from this last meeting that we had had a lot of communication about education, and I think that we've been doing okay, but I think we're going to step up our game. And there's a lot of interest on the board from members of being certified and getting that going, and so I'm excited about that. I think anytime you can step in and learn more, the stronger you'll be. So
great. Well, that's going to be a nice segue to talking about what THT might continue to do to help orient and educate board members. Before I turn things back over to Susanna, let me just check and see if anyone had any additional advice for boards in overseeing community health needs and initiatives. And I'll go Jordan, then Jason, then Carrie. Jordan, any additional advice that we hadn't gotten a chance to talk about yet?
Yeah, I think we've probably said it a lot, but I think that it can be said 1,000 times. Communication is really the biggest piece. Having those open lines of communication and transparency, that's one of our, it's part of our mission and our vision. We want to be transparent with everyone, our patients, our community that we serve. So we really don't keep secrets, if you want to say. We're just open and want to keep those lines of communication as open as possible.
Great. Jason, any other advice for the trustees watching this program?
Yeah, the only thing I would add, Pam, is I would encourage boards to be very intentional as they have vacancies to fill, as they have openings on their board and are looking for new board members, to just be intentional about including the things we're talking about today as part of that nomination and review process as you're identifying those potential future board members. I know most boards are like ours, and you have a wide variety of business backgrounds and interests, from business people and real estate people and lawyers and medical professionals who really bring a lot of great insight to the hospital business and those unique perspectives. But I would encourage boards to make community health improvement and population health part of that discussion as well, and make sure that you are bringing in board members like what we have here at WISE, who have so many different areas of interest and areas of involvement with charities and faith-based organizations to really bring that perspective of, hey, what's going on out there as far as needs in the community that maybe we as an organization can step in and address.
Right. Carrie, any other closing comments from you, either on the point that Jason just made or any other advice you have for your fellow trustees?
Well, I would agree with that. Jason touched earlier on being respectful of our time, but this board puts in a lot of hours, but there's no complaints. There's a lot of passion in each seat that wants to make a difference, and I would just encourage, as like Jason said, as they're filling seats on board, to really take all that into perspective, because it's just really, really important.
Yeah, I find that actually most board members across the country get really excited when they talk about what are the needs of the community. That's why they joined the board, is to make sure that they can help improve the population's health. Whether or not they would have used that term doesn't matter. They really care about, back to the beginning of the conversation, Jason, the mission. They're there to help support your mission to improve the community's health. So I think the more we can do to connect those dots for people who serve on the board, the better everybody's going to be. And I bet your board meetings are, really exciting when you're talking about what it is that's really needed to make sure everybody's healthy and safe, especially as we've been coming through a pandemic. This whole topic of community health and population health improvement is absolutely critical. And so I think it's great that you have such a wonderful program. And I'm sure that our listeners are really excited to learn even more. So I'm going to go ahead and turn it back over to Susanna to mention some closing comments about where you might be able to get more resources, those of you who are listening to this particular program.
That's great. Oh, did we need to talk about this particular image as well?
Sure, that would be one of the resources. Jordan, you want to explain what that is?
Sure. So this is just I guess a Facebook ad or a marketing ad that we put together to advertise the survey for this year's Community Health Needs Assessment. So just a little bit of background on the left-hand side with our previous rankings from countyhealthrankings.org and the top 10 needs that were identified that developed those committees. So it'll be interesting to see how those points change based on the data for 2020. So hopefully we'll be done in November.
Fingers crossed for you.
Fingers crossed.
Great. Well, Carrie and Jordan and Jason and Pam, of course, thank you so much for your participation and for this wonderful conversation. We just appreciate you candidly sharing your experiences and case studies and advice and challenges and all of that with our audience. As a reminder to all of you listening, you can find additional resources on our website, which is tht.org/straight talk. Those images that you saw and some others provided to us by Wise Health System will be available for download, as well as our speaker bios, so you can get to know them a little bit better. As Carrie mentioned, if you have a certified healthcare trustee designation, you can receive continuing education credits by listening to this program and downloading the continuing education form. And of course, if you have any questions at all or want to get in touch with some of our participants, please give me a shout at my email address here or by visiting tht.org. So please know that episodes of Straight Talk for Texas Trustees will be dropping on our website every month. So please keep an eye out for those and keep an eye out for our next conversation. So thank you